Well, Amen has a whole series of videos that churches and health workers can use that describes the effects of COVID and ways that we can prevent that through things like vitamin D and sunlight, exercise, water, trust in divine power. And today we're going to focus on one more way that we believe that we can prevent COVID from actually wreaking devastation in our lives and in our church members. And so I have with me my wife, Dr. Lyndi Schwartz. She's going to just tell us a little bit about the effects of COVID and why we definitely don't want to get it. And then Dr. John Shin will be talking a little bit about the vaccine. So Lyndi, tell us about COVID.
So this particular virus, it was called the novel coronavirus. It is actually one of a family of coronaviruses, and we have all of us have had a coronavirus because it's one of the causes of the common cold. But the difference between those viruses and this particular one is that this one is very destructive. It is a multi-system disease that causes many of our body organs to fail. So, for example, when we talk about COVID-19, it is caused by a virus, and the whole name is severe acute respiratory syndrome coronavirus. It is not just respiratory though, because it also affects the heart, it affects the kidneys, it affects the brain, it affects the blood vessels with blood clots and so forth that can be really catastrophic. And what we have witnessed in the last year and a half is truly the devastating effects on families, including the children in the families, the parents. Initially we thought it affected the elderly people most, and many pre-existing conditions such as obesity and hypertension, diabetes and so forth were felt to be risk factors. What we do know about the disease is that it manifests itself in a variety of ways, including asymptomatic people and people that have the full spectrum requiring mechanical ventilation to support their breathing and so forth. The problem with this virus is many viruses just come and they have their symptoms, but then they disappear. But this particular virus has the capacity to continue affecting people even when the acute infection is gone. For example, now we're receiving reports that the effects on the central nervous system, most common complaint is a foggy brain, and that happens in about 1/3 of people who have it. This is a serious disease, and although we have many treatments to affect the virus at various stages, we still have not done enough. And now we have the opportunity to do a whole lot more in terms of prevention and treatment of this disease.
So you definitely don't want to catch it. It's devastating, and so one of the very best things we can do is prevent it. So Dr. John Shin is actually a fellow at the National Institutes of Health, and we'll ask John to just tell us about the various vaccines and how they work.
Yeah, sure. So there's currently 3 vaccines that are authorized to be used for COVID-19, and these were authorized under the Emergency Use Authorization Act. And the 3 are the Moderna vaccine, the Pfizer vaccine, and the Johnson & Johnson vaccines. So let me talk about them kind of separately, because the Moderna and the Pfizer vaccines both are considered mRNA vaccines. And mRNA vaccines are new in the sense that they've never been used in humans for a disease up until now. This is the first instance of us having mRNA vaccines. And this is what causes a lot of people to be concerned. And they say these are very new types of vaccines. How do they work? Is it modifying my genes? What kind of deleterious effects could it have? And so let me talk about how they function. So an mRNA vaccine essentially is a vaccine that accomplishes the same thing that a traditional vaccine does, just in a different way. So let me explain that. A traditional vaccine takes a piece of the virus and purifies it and injects it into your body so that your immune system encounters it. But it's not the whole live virus. It's a piece of it, or it's a weakened or deadened virus. And that way your immune system learns how to recognize that infectious agent. Now, what the mRNA vaccine does is, instead of taking a piece of the virus and doing that, it puts a piece of code, mRNA code, that teaches your cells how to make that piece of the virus so that it can then accomplish the same thing. Now, for those of you who may not know what mRNA is versus DNA, the best analogy I like to use is a cookbook. So if you view your DNA as a cookbook, and it's the cookbook of life, it has all the recipes your body needs to make anything it needs. mRNA is a page from that cookbook, a single recipe that teaches your body how to build one of those things. And so imagine that you're preparing dinner and you want your entree that night. And so you make a copy of that recipe from your cookbook and you take it with you into the kitchen and you cook your meal. And at the end of the day, you throw away that copy because it may have gotten messed up in the middle of cooking and you don't need it anymore. But your original cookbook is not altered. And the next day, if you want to make a different dish, you make a copy of a different recipe, bring it with you. And so that copy is the mRNA. The cookbook is the DNA. So an mRNA vaccine is simply packaging a set of instructions that your cells don't have in the DNA, and it gives it to your cells, and the cells say, well, I haven't seen this recipe before. It's not in my cookbook. I'm not going to add it to my cookbook, but I'm going to build this because I was given these instructions. So it will build the piece of virus particle, the spike protein, and it'll use that to introduce your immune system to this novel agent and therefore build immunity. So this is how the Moderna and the Pfizer vaccines work. Now the Johnson & Johnson vaccine works essentially in the same way in the sense that they're accomplishing the same thing, but it does it differently. It delivers, instead of mRNA, it delivers a piece of DNA in a weakened virus that can't affect you. And it's an adenovirus that it uses to infect the cell, and it gives DNA. And then now people might say, well, that's the cookbook. I thought you just told me that it's not going to affect the DNA, the cookbook. Well, what it does is it's like an addition to a separate volume. It's not modifying the original cookbook, which is your DNA. It includes a separate page, if you will, out here that then is turned into RNA, which is then turned into the spike protein. So it's one step removed. It still does not modify your original genes, your DNA, but it accomplishes the same thing as the Moderna and the Pfizer vaccines through that mechanism. So both of these, all three of these vaccines manufacture the spike protein from scratch using your body's cells. So that's the common thread for all three vaccines.
So thank you, John. So the way I think about it is that both vaccines are giving us a piece of protein that the body then would recognize if it got infected with COVID. In my mind, there is concerns raised about how does that protein affect our immune system and does it have downstream effects? But we're going to get exposed to this protein either through the virus itself, and in that case there could be hundreds of proteins with it that could affect our immune system in far more ways, or we can get just this little targeted protein that is just for the spike protein. It doesn't alter our DNA. It just trains our immune system to recognize that if it sees it again. And so really it should have a lot less immune effects than getting exposed to the virus itself. Lyndi, can you tell us just a little bit about the development of the vaccine? Is it its first time used in humans, but what's been the process to develop it?
So I think one of the greatest triumphs in vaccinology is this particular vaccination. The concern that's been raised by many people, and I think one of the major concerns is that this vaccination was so new and done so rapidly that it wasn't adequately tested. And what is interesting is that we have been blind to what's been going on behind the scenes, out of sight in terms of these vaccinations. And what we recognize, it takes years and even decades to develop any vaccine. However, in this particular case, it has been decades that this technology has been investigated. So behind the scenes, two activities have been proceeding. One of them is the development of adaptive platforms such as messenger RNA and vectors to develop vaccines. The second one is using structural biology to develop and design immunogens that would stimulate the immune system. Those immunogens usually are coming from some sort of protein on the virus that they can target directly. This was first looked at with the HIV. We're familiar with that. And if you remember HIV, that was in the 1980s. And very similar to the spike protein, that particular platform was looking at developing the immunogen similar to the envelope protein on the HIV virus. Now, we've never developed a vaccine against HIV, but then the people that were looking at respiratory syncytial virus, a very common virus that causes symptoms similar to the flu, that virus also has a spike protein. And those researchers began to look at those looking at the HIV virus and the envelope protein, that platform. They said, we can begin to look at something similar, developing an immunogen which is similar to spike protein, and looking at it before it actually infects the cell. We call it pre-fusion conformation. And looking at developing a vaccine that would use that particular kind of platform. So, and interestingly, the immunogen had to be able to be adaptable to be used by multiple vaccine platforms, including the messenger RNA and vector platforms and so forth. So this is not actually new technology. This has been in the works now for decades, at least since HIV, looking at using parts of the virus as an immunogen to stimulate the immune system. And that's what this vaccine is. So it's really not new at all. It's decades old. Interestingly, this many vaccines in less than a year is novel, and I think it's remarkable. And I think it's a testimony to how the God of science has worked through the scientists to develop very effective ways of protecting society.
If I can kind of build on what you're saying there, Lyndi, a lot of people have concerns about how quickly these vaccines were developed, and so they're thinking maybe shortcuts were taken with safety, and now we're all experimenting on the public without knowing what kind of adverse effects this may have. And one thing that we need everyone to understand is that yes, these vaccines were developed in record time, but not because safety corners were cut.
Yes.
For example, a lot of processes that usually are done sequentially were done in parallel. For example, animal studies are typically done first, the data is analyzed, this takes usually a year or more, and then human trials begin. But instead, the FDA allowed people to do concurrent animal and human trials at the same time. So this was a risk that those trial participants were taking, but they were fully aware of the risks and they agreed to it because of the pandemic crisis.
And even during that time, they started manufacturing the vaccine, hoping that those trials would prove effective so that as soon as they had the results in, they could roll out the vaccine. And that's never been done before.
Absolutely, because you can imagine that for traditional situations, if you manufacture a vaccine before it's proven to be effective and before it's granted FDA approval, you would have wasted a lot of money. But the government was willing to eat the cost if it turned out that the vaccines were not effective. So the companies were able to push ahead and manufacture before even the trial data came in. But when it comes to the trials themselves, the human trials, there were no shortcuts taken for those trials. They went the full length, the safety data and everything was just as any other traditional vaccine trial.
Yes.
And I personally, actually Lyndi and I both personally got vaccinated back in December of 2020. It was a huge relief to be able to be vaccinated and to know I had that extra protection. And I just would like to point out that back in the dark ages, a third of the population, millions of people would be wiped out by various pestilences, the plague and various things. With the development of vaccines, we've been able to eliminate or control things like smallpox and polio and a lot of childhood illnesses. I personally believe that more lives have been saved because of vaccines than even the introduction of antibiotics or many of the other modern technologies. So vaccines are very effective if they're produced right and they're understood, and I have great confidence that this is another way of protecting ourselves against this pestilence that we face with COVID-19. A concern that many Seventh-day Adventists have, though, is, well, either I trust God's methods or I use science. Am I compromising if I get the vaccine, and does that then show that I have weak faith? And John, could you maybe address that a little bit from your own experience?
This is a question that's near and dear to my heart because it seems to be that if you trust God with your immune system, if you follow all of His laws of health, if you live the right kind of life, then shouldn't that be enough to protect you from any kind of illness and disease, including COVID-19? And if so, why get the vaccine? And when we tell people about the benefits of vaccination, let's be clear, every medical intervention has potential side effects, and the vaccines are the same way. There are potential side effects. Some people very rarely get a serious side effect called anaphylaxis. They're deathly allergic to the vaccine. That happens. You have people who are deathly allergic to bananas and fruits, but that doesn't mean that you stop eating fruits because some people are allergic to them. It's just you have to take the risks and the benefits. So some people ask, if I'm living the best life possible to maximize my immune system, why even expose myself to that little risk of something bad happening? And it's a great question because they feel like either I trust in God to protect me or I trust in the vaccine. And which am I going to trust? Is it going to be a denial? Is it hypocritical of me to say that I trust in God and still get the vaccine? And I look at it this way. There's many ways to approach the problem. But when you learn to drive, you go to driving school, driver's ed, you get your learner's permit, you get your driver's license, and then you pray before you drive, hopefully, to ask God to protect you on the road. And you do the best you can. You obey all the laws, you don't run red lights, you stop at every stop sign. And yet you still put on a seatbelt. Is it hypocritical for you to ask God to protect you after you've done all those measures to still put on a seatbelt just in case you get into an accident? And obviously the answer is no. What about asking God to keep you and your family safe at night, and yet you still lock the door? Why do you lock the door? Why do you avoid walking in dark alleys by yourself at night in crime-ridden neighborhoods? So what I'm trying to get at is that it is not a denial of faith to take proper precautions. And even as a physician, I want to minimize the drugs that I'm exposed to, and I'm sure everyone has the same sentiment here. But at the same time, we understand that despite our best efforts, we're living in a fallen world with degraded DNA. And due to no fault of our own, sometimes our immune systems are not sufficient to protect us from all of the things out there that can infect us. And COVID-19 is one of them. So given that situation, I think the benefits of the vaccines far outweigh the risks.
Okay, so we've just very briefly scratched the surface about the benefits of vaccines. There are risks. You have to weigh this between your own health team and your physician and pray about whether or not you should get vaccinated. But we just wanted to try to make people aware that the vaccines are scientifically based. They're based on physiology. It uses science. We think they have been very effectively studied, and with COVID being so devastating, we want to use every single tool available to us today to be able to defend against it. Thank you.